Hi, Assalamualaikum. My name is Muhammad Abizan. Okay, for introduction, first, the issue we choose is COVID-19 crisis. The definition is COVID-19 is an infectious disease caused by a newly discovered strain of coronavirus, a type of virus known to cause respiratory infection in humans and also can lead to death. Aim and background of COVID-19, a novel phenomenon. Disease originated from Wuhan, China, was confirmed by the World Health Organization on 12 January 2020 before becoming an outbreak in all countries. Action taken by the Malaysian government enforced the movement control order starting from the 18 March 2020 to seriously break the chain of COVID-19. Provisional hospital was set up, collaboration with healthcare service providers, migrant will additional laboratories website in enhancing the proficiency of the Ministry of Health. Next is definition of the crisis drill, responses and messaging on COVID-19 cases. First, crisis drill. Drill and simulation range from the discussion and role play that the hospital Kuala Pilah take place in one room to realistic crisis, which is COVID-19, involving people and equipment at once or more location, actually simulating emergency action about it. Second, responses. An emergency response of action that Hospital Kuala Pilah must take immediately following the COVID-19 cases and includes potential interaction with the outside help, including public safety, to overcome this crisis. Third, messaging. Crisis communication that used by the Hospital Kuala Pilah, that's it, designed to protect and defend an individual, company or organization by the spreading words of the COVID-19 disease.
My name is Muhammad Araika bin Ibrahim. I am taking diploma in risk management and my matric card number is TRM 181006. Okay, so in methodology, what our group carry out in this topic methodology is about virus COVID-19 nowadays, and also we learn from Hospital Kuala Pilah in Negeri Sembilan how they take care or handle these cases with their own ways. Okay, so meet the doctor from Hospital Kuala Pilah, and we set the appointment with doctor on 27 May 2020, which is during COVID-19. I mean in Malaysia that we still PKPP, which is in Malay we call it Pergerakan Kawalan something like that. Date 27 May in 2020. So we still connect with that doctor because of during PKP, which is Perintah Kawalan Pergerakan in Malay, and we collect the data from the doctor that how Hospital Kuala Pilah handle the crisis COVID-19 through crisis drill, response and messaging, and we doing and after that, after we collect the data, we do some research, a quite challenge, especially doing group research through online, because during PKP and all the data from internet platform nowadays, but we did complete our task. And we as a student doing some survey about pandemic COVID-19. And first, we create 12 random question to ask the doctor about COVID-19, how hospital Kuala Pilah handle the cases and so on. And second is we set a appointment with a doctor based on 12 question, and that can relate it about crisis drill responses and process that by use the hospital Kuala Pilah in Negeri Sembilan. And lastly, we use the survey question that has been answered by the doctor to make a report. Okay. Lastly, respondent include. Okay, so we as a student should see how respond by the doctor. So there's only one respondent, which is a doctor of Hospital Kuala Pilah. So I pass by Shami.
Okay, hi, my name is Muhammad Syami bin Muhammad Shukri. My metric number is DRM Y1003. Okay, next I want to present about result of survey. Okay, the place that we research is health industry is Hospital Kuala Pilah. Okay, the specific issue is COVID-19 cases. Okay, for the first question is how does Hospital Kuala Pilah handle the COVID-19 during pandemic in Malaysia? Okay, Hospital Kuala Pilah make a screening emergencies department and main interest of hospital clinic staff. Hospital will screen temperature, symptom of fever and history of travelling. Okay, next, all patients have symptom or suspect positive COVID-19. The staff will take the sample and put the patient to the isolation ward for treatment. Next, all staff need wear the personal protective equipment, which is PPE, when handling patient. Okay. For the second question is what type of cases drill using the hospital during COVID-19 cases. Okay, cases drill the hospital during COVID-19 is crisis preparedness and response center, that is CPRC, where all the case will be notified to the CPRC hospital and to the level of state. Okay, for the third question is what type of method of practice used by the hospital Kuala Pilah during COVID-19. Method of practice used by Kuala Pilah during COVID-19 first, staff need to protect themselves with full PPE. The next, screening at all hospital interest, and third is isolation room. Okay, the fourth question is where do the hospital get their equipment during pandemic COVID-19? Okay, the hospital get their equipment from during pandemic COVID-19 from KKM. Okay. The fifth question is how do the hospital spread their message about COVID-19 to others? Okay. Stroke crisis preparedness and response center, that is CPRC. Okay. Question C is what type of training used by the hospital Kuala Pilah during COVID-19? The hospital use the type of training is continuing medical education, which is CME, for staff about PPS and handling sample. The question 7 is who is the spokesperson of Hospital Kuala Pilah during COVID-19? Okay, the spokesperson of Hospital Kuala Pilah during COVID-19 is director and deputy director at Hospital Kuala Pilah. Our is chairperson CPRC. Okay. question 8 is how do the hospital Kuala Pilah respond to the COVID-19? Which is the same answer with the question 1. So let me repeat it. Hospital Kuala Pilah make a screening at emergency department, and main entrance of hospital or clinic staff hospital will screen temperature, symptom of fever, and any history of travelling. And next, all patients who have symptom or positive COVID-19, the staff will take the sample and put the patient to the isolation ward for treatment. Okay, and then all staff need to wear full personal protective equipment, which is PPE, when handling patient. Okay, next the question 9. How does hospital Kuala Pilah deal with internal and external communication during COVID-19 cases? By taking time into from CPRP, KKM, and NKN. Okay, next, by not drenching medical personal information of patient. Okay, for the next question is question 10. What are hospital Kuala Pilah intervention plan during COVID-19 cases? Okay, the hospital Kuala Pilah intervention plan during COVID-19 is continue guideline from KKM. Okay, next, the question 11 is how do hospital Kuala Pilah evaluate on existing crisis plan on COVID-19 cases? Okay, the hospital update and guideline and education staff. Okay, and the last question is question 12. How hospital do media training during COVID-19 cases? Okay, the answer is by letter CPRC or spokesperson with its director to release statement. Okay, that's all from me. So next is recommendation and conclusion.
Hi, my name is Sheikh Shaidi. My metric number is DRM 1N1008. Today I'll be continuing on the conclusion. From the result, does the function of crisis drills, response, and messaging functions really beneficial to the staff or not? Yes, the crisis drills, response, and messaging functions that used by the Hospital Kuala Pilah really gives positive impact to the organisation in handling the COVID-19. For example, crisis drill plan of the Hospital Kuala Pilah helps to ensure employees are capable of effectively implementing them and have a necessary skill set to respond effectively to unanticipated emergencies such as COVID-19. Besides that, the crisis response of the hospital is quite fast in taking immediate actions and effective usage of standards in the actions and messages, which is prompt, compassionate, honest, informative, and interactive. Lastly, crisis messaging of the hospital Kuala Pilah on spreading the words about the COVID-19 is really effective, followed by the guidelines given. So the employees, company, and public should know that COVID-19 is a dangerous disease and knowing to against it. Next, I will give one recommendation that the hospital need to follow, which is to spread more awareness about the disease, because the disease is really dangerous, so others would know how to against it and how to protect themselves from it. Thank you.